I am Dr. Aparna Rao. I head the glaucoma services. After several years of experience and as a clinician in working in glaucoma for the past 16 to 18 years, when I'm asked that question, what is glaucoma, my definitions have changed. So traditionally, for the layman, for the common person, glaucoma means eye pressure, which means because the eye pressure becomes high, there is damage to the optic nerve consequently, which happens after the pressure buildup remains for a long time. But over the years now, our understanding has improved, wherein there are pressure independent mechanisms also for the causation of glaucoma. So glaucoma basically means a group of disorders wherein the optic nerve gets progressively damaged, maybe because of eye pressure, high eye pressure, but also can be due to other factors. But the risk factor that can be modified in this disease remains the intraocular pressure or the eye pressure. Glaucoma is by definition a multifactorial disease. There is no single cause for glaucoma. So if you ask what is the cause of glaucoma, there is no single cause of glaucoma that can be pinned and said, if you remove this cause, the disease is cured. It is multifactorial, just like other diseases like blood pressure or diabetes. Glaucoma primarily does not cause any symptoms. It is supposed to be an asymptomatic disease and is often called the silent thief of sight, which means that it causes damage inside the eye without letting the patient know that it is causing damage. And this happens because the patient has no symptoms until almost the last stage, where just before blindness, where the patient might feel that he or she is not seeing clearly. So by principle, glaucoma does not have any symptoms. Glaucoma diagnosis is usually done by an array of tests, one of which includes the eye pressure or the intraocular pressure. The doctor that you consult will also ask you to undergo a slit lamp examination, a gonioscopic examination, a biomicroscopic fundus examination, and also if there is a suspicion of glaucoma that is confirmed after examination, he or she may advise also some tests, confirmatory tests like visual fields and optical coherence tomogram or glaucoma imaging. The treatment of glaucoma can be done in two ways. First, we try to reduce the pressure and to control the damage with the help of topical medications, which means eye drops. So most of the cases can be managed medically, regular use of eye drops. In certain cases, when the eye drops are insufficient to control the eye pressure or halt the damage, then we advise surgery to control the damage. Surgeries in glaucoma can be of two types. Traditionally, all these years we have been doing open surgeries, which is called trabeculectomy, wherein a tissue or a window or a block of tissue is removed to allow the passage and drainage of the water fluid inside the eye to reduce the eye pressure. But newer advancements called minimally invasive glaucoma surgery has now allowed us to do the reduction of eye pressure, achieve reduction of eye pressure without having to cut open the tissues in the eye. And this is made possible by the use of micro scissors and micro instruments, which allow us to do the surgery through very small incisions. Minimally invasive glaucoma surgery includes GATT, which means gonioscopic assisted transluminal trabeculotomies, goniotomy, trabeculotomy, and ab interno-trabeculectomies. We are now doing all these procedures, and the advantage that we have felt with these procedures vis-a-vis the traditional procedures that we have seen for the patients is that we are able to achieve sufficient reduction of eye pressure without having to actually open the tissues and through very small incisions. So the recovery rate for the patient is very fast, and also the patient is much more comfortable than with a traditional trabeculectomy surgery. Glaucoma, like I said, is a multifactorial disease. So if you do not know the cause, we do not know how to prevent it. But an early diagnosis actually can go a long way in preventing blindness in this disease. So anybody with a family history of glaucoma, anybody with the use of with very high power, which are called high myopes, with a history of diabetes or blood pressure, or with any other risk factors which are known for glaucoma causation, if you have that, it is advisable to get your tests done with an eye doctor in a detailed manner to rule out glaucoma.